Hello, my name is Terry Walker and I'm the Director of Operations. I have responsibility here for the Clay Community Care Clinic. I also have some responsibility for other outpatient ambulatory centers that we have that are associated with Piedmont Athens Regional. And I just want to say welcome to the Clay Community Care Clinic. What I want you to get from your orientation here is to know that you have a great team here behind you at the clinic and that we are here to help you. If you have any questions whatsoever, or if you are concerned about a process, please ask us. You have a very experienced team here behind you that knows exactly what they're doing, and they know how to take care of patients, and they know how to make a good environment for you here. Welcome to the state of Georgia if you've never been here before, and if you're from out of the country, welcome to the United States of America. But please give us a call if there's anything that we can do for you. We're here all the time for you.
Hi, my name is Matt. I'm the practice manager over the clinic. My main role is to handle all administrative duties for the residents and the staff and the attendings, to include IT issues. I manage the safety huddle, any other issues that may come up, any QI projects or anything like that that you have going on that I can assist with. I'm here to assist with anything really administratively. So if you need anything, just come to me and I will take care of it.
Hi, I'm Nancy, the front office coordinator. We handle all the scheduling, the registration, the check-in, check-out for all the patients here at the community care clinic. We also do the scheduling for the specialty clinic downstairs for internal referrals. Two key things to remember. First would be to make sure you mark yourself as the primary care physician in Epic when you're seeing a new patient. Also be sure to use your checkout notes for any follow-up instructions when scheduling a patient. For any other questions you have that come up as you're working, feel free to reach out to any one of the front office staff and we'll be happy to help.
Hey everybody, I'm Ruby Fleming. I'm one of the lead CMA at the Community Care Clinic.
I'm Kelly. I'm a CMA at the Community Care Clinic too. And we're just going to tell you a little bit about what the CMAs do at the clinic. Do you want me to?
Go ahead, Kelly.
Okay, so we pretty much break it down into two different sections. One's going to be what we do in-house in the clinic, which is going to be everything from rooming patients, which includes getting vitals, going through the med rec, doing their depression screenings, anything like that, last menstrual period, any of that type of stuff, asking them what they're here for today. And then from there, we will meet with the resident and the attending in the preceptor room. We'll go over what the patient's here for today. You'll do your visit, and then when you're finished precepting, you will, if you're ordering lab work or any type of additional stuff to be done with the patient that day, you will put the lab orders in the computer, and then you will bring the clipboard up to the MA section. You'll let us know what's going on, and we'll look in the computer, and any type of blood work or anything like that we will do in clinic, whether it's POCT stuff or actual lab draws. We do that here. Vaccines, pregnancy tests, anything to do with urine, any of that type of stuff. We will do that, and then circle back, let you know that everything's been taken care of. And then from then, you just let the patient go or handle it however you're going to handle it. And then on the other side, we do is mostly admin. So anything from patient referrals, prior authorizations, getting medications approved to their insurance company, making appointments at specialty clinics, whether it's urology, cardiology, any of that type stuff, we can handle that. Refill request. What am I missing? FMLA paperwork. We don't do disability, but we do FMLA. So we'll do, we handle all of the paperwork stuff. We'll keep it up here and let you know through Epic if we have anything for you to sign or fill out.
And we contact the patient after everything's done, like paperwork wise.
I have a question. What if the resident needs to find an MA for a lab test or any requested referral?
Lab tests, they can ask any MA to draw labs on their patient. But referrals, they will go to their team MA. So we all the MA have a team.
Each color team is assigned their own MA. You'll be assigned your own attendings, your own front office check-in and out person, and your own MA. So your MA that is assigned to your color team is going to handle all the admin side of the clinic. Anything in clinic, like rooming, labs, all of that stuff, you can ask any of the MAs. We're all up for grabs.
What if the resident needs a parking permit for one of the patients?
Handicap.
A handicap placard. So we keep them up here. The way that the handicap placards work is you'll fill it out. Lisa will have it notarized. You'll have to do the whole form. But once it's notarized and signed by you, we get the patient to sign it, and then that's it. We'll call, let the patient know.
Hi, I'm Ruby. I am the lead CMA at the Community Care Clinic, and I want to introduce you to our lab. So this is our lab. This is our caddy. We take these in the room, and to the patient we draw blood, and we come back. We process the lab here. We set the specimen here, and then we put it in the centrifuge, and we spin it down, and then we send them out to Piedmont. We have 3 labs we use. We use LabCorp, Piedmont, and Quest. But most of our labs go to Piedmont. We also do point of care tests here. We have a UA machine. That's for urinalysis. We have a A1C machine here. We get your we do that here. You get your results back in 5 minutes. We do point of care hepatitis C and point of care HIV. Hepatitis C take 20 minutes. We get the results back and give it to the patient while they're here. And the HIV only take 5 minutes. And we do have a hemoglobin machine. We do POCT hemoglobin. That take like 5 minutes, but that is downstairs. This is our microscope. The doctors come, they look at specimen under the scope. Most of be vaginal stuff. And yes, we have our swabs here. We have like the wound culture, the prep for men's, we do GC, gonorrhea. We have urine cultures we do here.
Hi, my name is Lindsay. I am a CMA here at the clinic. I have been here coming up on 2 years. So I am down here in Suite 101. We're going to talk about some of the specialty clinics we have here. We have 6 different clinics that we do downstairs in Suite 101. We have geriatrics, ID clinic, pulmonology, eye clinic, hemo, am I missing one? And nephrology. So those are the 6 specialties. As far as the MA process goes for those, it's the same as upstairs. We room the patients. They check in at check-in. We room them, bring them back, and triage them. Some of the special things that we do for specialty clinic. Pulmonology, we sometimes, for Dr. Pipham, we have this spirometry test that we use. Not going to open that, but you will learn that, I'm sure, at some point. We do labs down here as well. Everything's the same in the lab as it is upstairs. We offer POCT test, all of that.
So what's a point of care test? So point of care, we often refer to it as POCT, or a test that we collect, run, and subsequently result here in the office. So we've got a few point of care tests that the nurses already showed to you, the MAs. We've got these little machines that can run and result things here in the office. So a couple of things that we have available are glucose, so blood glucose, hemoglobin A1C. We've also got a hemoglobin to get an HB. We've got urine dipstick and rapid streps for flu, mono, and strep. Let me think if I'm forgetting any of them. We've also got screening tests for HIV and hepatitis C. So these tests, some take about 15 minutes to result. So the key here is going to be that you get them going as soon as possible. There are a couple of ways to do this. Some of it will be MA driven. So your MA will room your patient and say, and say, oh, you have pain with urination. Let me get a urine test straight away. So that's MA driven. Another way would be you are pre-charting, you're like, oh, my patient is due for a hemoglobin A1C. Let me pen this. Then the MA can get it on rooming and we get the result early on. So when you're going to go see the patient, you already know, oh, the A1C is 7. This really helps with efficiency for your visit. So some of the key things are going to be that if you think you need any kind of point of care test to get that going as early in the visit as possible. So after you see the patient, you're like, oh, I think they might need hepatitis C screening. You don't have to ask us. Just order the test and tell the MA to get it when you're precepting, so we get the results by the time we're done.
Hi, I'm Julie Miller. I'm one of the nurses here at the Community Care Clinic. Welcome to Athens and our clinic, and I hope you are going to enjoy your next 3 years here. Some of the things that I do here, Eddie and I, Eddie's the other nurse and he is not here today, but we do the transition of care list. So when you're in the hospital, you may drop patients on that list from time to time that need follow-up with a primary care doctor. We also do a list that is an ED follow-up list. So when you're in the ER, kind of the same thing, patients that go to the ER frequently can be placed on a list for us to call and try to get them in to establish care somewhere so they can avoid going to the hospital. Right now, I'm kind of managing our internal referrals list. Hope to soon turn that over to someone else in the clinic, but right now for our specialty clinics downstairs, pulmonary, ID, hematology, any of them, I do the referrals list and make appointments for those patients. I've been doing that for the infectious disease clinic the entire time I've been here. Just picked up all the other specialty clinics as well. And some of the other things we assist with are any needs that attendings have or residents have just on the daily flow in the clinic. So any kind of backups we see, or patients that are late, or patients that just show up and we want to try to fit them in, we just try to see where empty slots are in the schedule and we can move patients around. Also, if any IVs need to be started, we are your people that would do that. You would come get Eddie or I to start an IV on a patient. We do have a procedure room. We try to put those patients in. That doesn't always happen, but we can set them up in there if it's available. We also assist with any procedures in the clinic, and we have some procedure caddies. So when you get here, you can come and see one of us, and we can show you where those are located. We also assist with any kind of emergencies in the clinic, so patients that might need oxygen or sometimes EKGs. The CMAs normally do the EKGs, but any of that kind of equipment, though, you could come and find us. We do have an ultrasound in the office, too, that you could come and we can assist you with that as well. We also have emergency kits in the clinic. They are kind of located in the same vicinity as the procedure caddies. So we will show you where those are as well. They're labeled. They're basically anything you would need for that particular emergency. Just for example, like a hypotensive patient that would need fluids or something like that, or hyperglycemic patient. We have fluids in there, the medications you would need. It's just all in one caddy that you could get and take to the room, and then you could treat the patient without having to go back and forth to get supplies. We also do have a medication cabinet. I left that off earlier, but we have a medication cabinet that if a patient needs a medication in the clinic, that we can also give that as well. So you just place the order and then let us know that you placed the order, and then we go give the patient the medication that's needed. We do assist with some nurse visits. Some nurse visits the medical assistants do, but it's all deemed a nurse visit, and then we just kind of, everybody knows who needs to do that visit. But if they needed a blood pressure check, they were just bringing in their blood sugar logs. If they were doing just a med rec, like they came in for a visit with you but forgot their medications and weren't really sure about medications, they can come back in and we can enter those into the computer. We have done some injections for patients that need to come in. We have a couple of patients that come in, bring their own vitamin B12 when we do their injection. We do a lot of wound care. Have a patient coming in 3 days this week for wound care, and the nurses typically do that. So anything that would be a nurse visit to get them through to the next time they follow up with you, then we would take care of that as well.
Hi, welcome to the Piedmont Clay Community Care Clinic. My name is Tori. I'm one of the 2 ambulatory pharmacists here. Our role here at the clinic is to help the residents on a daily basis by answering questions about medications and helping to choose appropriate therapies. We also see patients for hepatitis C treatment, smoking cessation clinic, and also insulin titration. Some other ways that we can help your patients is by showing them how to use their devices, such as their GLP-1 agonists, their insulin pens, or their inhalers. We will also have some workshops throughout the year so that I can show you guys how to use these as well. One of the great resources we have at the Community Care Clinic is our Pharmacy Survival Guide. In this guide, you will find our frequently asked questions. I try to update it as often as possible to answer questions that we get frequently throughout the day. We also have provided you with a small booklet that kind of introduces you to our pharmacy services here at the clinic. Includes our prescription assistance services that Carmen has gone over as well. Other ways that I can help you here at the clinic, I can show you around GRITS, which is our state immunization registry website. It can be quite confusing, so please stop by and I can give you a brief tour. I can also create an account for you.
I'm Carmen Crook. I'm the prescription assistance coordinator here at the Community Care Clinic. And what I mostly do as part of my daily routine is help uninsured and underinsured patients get the medications that they can't afford. So there's a lot of resources that I use. The big one is the prescription assistance programs through the manufacturers of the companies that manufacture the medications. We do have a lot of samples that we try to get patients when they are here in clinic. Go ahead and get them started on the medication before we can get them approved through the program. Most programs get people approved for 1 full year. Unless they have Medicare Part D, then they are approved only until the end of the calendar year. We have a lot of resources that we use where we have a medication assistance fund where we can pick up the cost of medications for patients at our hospital pharmacy when people cannot afford their medications. That is a limited source that we have. We also try to use the Sparrow's Nest. They do take care of some patients' medication costs also. If you need me, I am in my office, of course, and also you can secure chat me if a patient is here in clinic and needs direct help where I need to get them to sign an application for assistance. You would just secure chat me and then I can come to the room, let me know the room number and the patient's name. That is a pet peeve of mine. And I'll be able to assist. For last fiscal year, so fiscal year 2020-2021, we saved the clinic $1.9 million in out-of-pocket costs for our patients. The year before that, we did save our patients $1.2 million in out-of-pocket costs for our patients.
Hello, I am Lisa Riley and I am the social worker here at the clinic. I've been a social worker for 30 years as of March of this year, and I've had several different experiences in my social work career, most of it being medical social work, discharge planning, outreach, nursing home, adult day health, that kind of thing. But I've also had a private practice where I work with families with traumatized children who are now in adoptive homes. So I have a lot of different experiences I can help with. The main thing I can help you with is this medical specialist resource guide, because as you are developing your medical plan, you will need to refer to specialists, some of whom will accept our financial assistance. 46% of our patients are uninsured, and I'm the one who finds the specialists for the uninsured. So what's going to be very, 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 very important is that you send me an inpatient or an in-basket staff message letting me know that you're making a referral for someone who is self-pay for a particular discipline, whether it's rheumatology, pulmonary, all of them. And there's I think I've got resources for about 34 different disciplines. We do have Dr. Deserts, folks that are not able to accept our financial assistance, and there's a list of those that I can share with you. So if you have any questions about any of these specialists that you want to refer to, you can always come to me and ask. And the Medical Specialist Resource Guide is on Blackboard. That is the most current copy. But the ones in the preceptor rooms, like this, are for you to hand to your patients. Most of our patients that are self-pay don't have connectivity, they don't have phones, they don't have a way to look things up. They need a piece of paper with a name and address and a phone number. That's what this is for you to review with your patients and to hand them the sheet of paper of where you both decide that you're going to refer to. As well, if you have any concerns about abuse, neglect, or exploitation of an elderly person, I'm the one you talk to about that. Community linkages to resources, homeless, food insecurity, social security disability, parking permits, transportation, drug and alcohol counseling, all that kind of stuff is what you would come and see me for. So if you have any questions about anything, you might get documentation that patients want you to fill out. If you're not sure whether you should fill it out or not, you can come to me and I can tell you this is private sector, you can fill it out, or if it's public government, then I can tell you that you don't have to. So if you have any questions, let me know and I'm available.
Hi, my name is Nancy. I'm with Piedmont Community Care Clinic. I'm the interim financial assistance coordinator. Just a quick rundown of what we do here. We serve the Athens community and greater area, and we serve all patients, whether they're insured, uninsured, or underinsured. So for patients who need the help, we do have a financial assistance program and a hardship program that helps with the patient's health care. Helps with testing, imaging, and specialist referrals. As of October 2021, we have approved 441 patients through the financial assistance program. So if you have any questions, whether you have any questions or your patient has any questions, feel free to reach out to me and we can help the patient and yourself guide you through the process.